Bell's palsy knowledge base. Today we discuss the following: facial palsy or Bell's palsy. What is the difference? In general, the paralysis of facial muscles is called facial palsy. It can be of a central or peripheral origin. Central facial palsy happens when certain structures of the brain become damaged as a result, for example, of a stroke. The main symptomatic difference between central palsy and peripheral palsy is that with the central palsy a person maintains almost unaffected control over the upper part of the face. He or she can close and blink her eyes, lift the eyebrows almost without any issues. With the peripheral facial palsy, when the facial nerve becomes damaged after leaving the skull, a person loses a complete control over the movements on affected side of the face. Depending on the causes, there are several kinds of diagnoses for facial palsy. The nature of damages to the nerve fibers and the prognosis for recovery is also different depending on these causes. Let's take a closer look. When the cause of the facial palsy is virus herpes zoster, then the diagnosis will be Ramsay-Hunt syndrome. Very often the facial palsy in the case of Ramsay-Hunt syndrome is preceded by intense pains behind the ear a couple of days or the day before the actual palsy happens. Lyme disease can also be the cause of facial palsy, and it derives from Borrelia type bacteria, which we get mostly from the tick bite. Otitis media, the inflammation of the middle ear. Tumors of various types, including acoustic neuroma. Iatrogenic damages means damages that result from surgical interventions in the area. Trauma, for example, temporal bone fractures and other injuries involving temporal and zygomatic areas of the face. Bell's palsy. Bell's palsy often results from local overcooling in the face, neck or head area. It can come from cold weather, from a wind, from air condition, from exposing yourself to drafts. Very often truck drivers who drive with open windows are the sufferers of Bell's palsy. Additional risk factors are stress, hypertension, last weeks of pregnancy. Some sources also name diabetes as a risk factor. In fact, Bell's palsy is a diagnosis of exclusion. If none of the known causes can be confirmed, then the facial palsy is considered idiopathic, which means without known or from unclear causes. In other words, if the causes of your facial palsy cannot be determined and confirmed, the diagnosis will be Bell's palsy.